Welcome doctors. Today, we're diving into something that rarely makes headlines but is breaking patients and practices alike: the crushing emotional toll of navigating health insurance claims. You know it better than anyone. Patients don't just come to you for care, they come to you carrying financial anxiety, billing confusion, and sometimes tears. One patient said it bluntly: "I fear I've reached my breaking point. I got PPO insurance at my new job, thinking I'd pay $20 per visit. Instead, after just 2 visits, my bill is $2,000. This isn't just about numbers, it's about real psychological harm. Some patients describe panic attacks every time a new explanation of benefits email hits their inbox. Others say they've developed PTSD-like symptoms from years of back and forth with insurers. Even healthcare professionals admit the strain. One billing veteran with 20 years of experience said, "Yes, I've cried in frustration over claims, and they weren't even mine." And then there's the phone transfer nightmare you and your staff know too well, being bounced between hospitals' labs, billing departments, and insurers, each one claiming the other has the answers. Hours lost, no resolution, and patients left in limbo. Even doctors with so-called Cadillac insurance coverage aren't spared. Some admit crying multiple times a week while managing both personal health crises and endless insurance bureaucracy. Families wait months for medically necessary equipment like a custom wheelchair for a child because insurers label it not medically necessary. Or patients discover the hidden reality of facility fees, where what looks like a routine office visit turns into hundreds or thousands in unexpected charges. And then there's the long game: multi-year battles over 6-figure claims where insurers deploy delay tactics. Deny first, deny again, and hope the patient gives up. Sadly, many do. Doctors, this is where we step in, not just as healers, but as advocates for change inside our own practices. Because the truth is, this fight isn't sustainable for patients or providers. What we're seeing now is the rise of dedicated virtual medical billing specialists, professionals trained to handle denials, appeals, and accounts receivable follow-ups systematically. Unlike percentage-based RCM services that eat into your collections, these teams operate on fixed pricing starting under $2,000 a month, with compliance standards like HIPAA, SOC2, and ISO 27001 fully covered. And here's the key: when billing specialists take over the fight, patients and providers alike can breathe again. No more waiting weeks between resubmissions, no more missed deadlines because staff are burned out, no more collections calls during appeals. Instead, every call, every denial, every escalation gets tracked, documented, and pursued until resolution. And for patients, that means fewer tears, fewer panic attacks, and fewer sleepless nights wondering if their insurance will suddenly reprocess last year's claims. So, what can we as doctors learn from all this? That insurance denials aren't just an administrative hassle, they're a mental health issue. They affect our patients' lives, our staff's well-being, and our ability to deliver care without distraction. The way forward is clear: bring in systems and support that prevent breakdowns, both financial and emotional. Stop asking patients and staff to become amateur billing lawyers. Let experts handle the denials, while you focus on what you trained for: delivering care. Doctors, the reality is hard, but the solution is within reach. By implementing systematic, compliant, and transparent billing operations, we can stop the cycle of crying, panic, and burnout and start restoring peace of mind, for our patients and for ourselves. Thank you for watching.